Hello everyone, it's Masuma Mishu here. I am a public health researcher and lecturer in public health based at University College London. In this short training video, I am going to discuss about the intervention specific to the SMILE project. SMILE stands for People with Severe Mental Illness Learn About and Engaged with Good Oral Health. So this intervention will be delivered by the medical healthcare professionals, and the setting is the mental health care services outpatient, and the service users with lived experience of severe mental illness will get this intervention. So when a service user with lived experience of severe mental illness will visit the mental health care setting outpatient, this discussion will be part of their regular conversation. It can start by explaining the importance of teeth and mouth, and mental health care professionals, they can say that our oral health as is closely related to our general health, so we are having this conversation with you. And the opening sentence could be, as we know, our good oral health is related to our eating, breathing, speaking, being socialized. So this oral health is not just oral health, is also related to our overall general health and well-being. So we are interested to have this conversation. We would like to know about how you are doing with your oral health care, and we want to provide you any additional support if you needed to get good oral health and maintain your good health of your teeth and mouth. Definitely the sentences could be changed and could be tailored to that specific patient. So here in this video we are going to share some of the guidelines that could be adapted specific to the patient. Then we can also take some information, give them some information about the connection of tooth and mouth with their overall body, but we need to take this message in a more positive way, that by keeping your teeth and mouth healthy, you can get a good overall oral health, get a good health in your heart, lung. It's also helpful for controlling your diabetes. So this oral health is also related to your general health. So by keeping good oral health, you are also more likely to having good general health. So we should try to take this message in a more positive way. Then to tailor this conversation, we can ask the patient about how do you feel about your teeth and mouth, and when you last visit, let's see, a dentist, and if they say yes, let's see a dentist, at that time we can say like why that dental visit was for. So this conversation will start the further conversation around oral health. So mental health care professionals, they can share that, as we know, there are some top advice that usually dentists give to maintain good oral health, how to keep your teeth and mouth healthy. And the first of all the common advice is try to brush your teeth twice a day with fluoride toothpaste. And last thing at night that you should do after having a meal is toothbrushing, and after that toothbrushing you should not eat anything apart from water. And in the leaflet that the mental health care professionals will give to their patient, this common like the advice on toothbrushing, general advice would be written there, so they can show them these are the common advice for dental brushing, how you can brush your teeth. However, as we know, this group of people, they might have some mental health crisis moment when they might not be able to brush their teeth twice a day. So these advice need to be tailored to that specific patient. If someone is not brushing at all, maybe then in that case try to encourage them to brush at least sometimes a week, and then when they will be able to achieve that habit, then maybe once a day, and when they will be able to achieve that habit, then maybe go for the twice a day. So it's not very strict kind of guidelines or the advice that we should follow for this population, and these should be, as I mentioned, tailored to the patient specific condition and their mental health level, ability, and then this advice should be tailored to that specific patient. When they reach up to the stage of brushing, then this further advice on how to properly brush your teeth. This demonstration, it could be a video demonstration. This picture will be in the leaflet, and there will be also a QR code. If someone is interested to watch the video of the toothbrushing demonstration, they can watch it. But these need to be, again, the advice need to be given based on the patient's condition. When they will be at the state of taking advice of how they should properly brush their teeth, the advice should be given at that stage. And the main message is that when brushing your teeth, you should be careful that all the surfaces of your teeth, both outer surface, inner surface, upper teeth, lower teeth, all these surfaces should be cleaned. Then we want to make this message more tailored to that specific patient. So the conversation could come about what is your barrier for regular toothbrushing. If someone said that they are not able to brush regularly, then this question could come like what are the barriers they are facing, and there are some common barriers would be there in the leaflet, so they can either take, for example, these are just some example, not having toothbrush and toothpaste, maybe being unwell, due to impact of mental health, maybe they're not brushing, maybe it's not their priority at this moment, or if other, then they can write it down. So they can then set up they can record the current frequency of toothbrushing, they can write it down, and then my next step, they can set a target what they want to achieve. For example, if anyone is maybe brushing once a day, they can set the target that, okay, I'll try to brush twice a day. If someone is, for example, brushing twice a day, then next step, definitely they will continue their brushing habit. If any barrier is identified, for example, not having toothbrush, toothpaste, they can buy it, and the tailored advice in a conversational mode would try to solve that problem. The related advice then will be on side effect of some antipsychotic medication, and mental health care professionals, they can just say that some of your medication can cause dry mouth. So if you have that kind of problem of dry mouth, you can sip water frequently. So that's a very general kind of advice they can give. The next step is about try to give them some advice to reduce their sugary food and drinks intake, and we need to make this link that why these sugary food and why we are having this conversation in the oral health. We need to say that this sugary food and drink is not only harmful for your general health, for example, diabetes, obesity, but it's also bad for your teeth and mouth, so that you should try to reduce overall intake of your sugary food and drinks. Especially you should be careful about the frequency when are you having these sugary food and drinks, because if you have it as a habit of frequent snacking, then it's more likely to damage your teeth. If you have to consume it, then like it can be with the meal, but not as a frequent snacking. And after having any sugary food and drink, you should at least rinse your mouth or clean your teeth properly, so that will reduce the harmful effect of these sugary food and drinks. And we should encourage them for the healthy eating, healthy meal more a balanced meal. And if the patient is already getting dietary advice from dietitian, then we can just link it with them, and if in this advice emphasize that yes, the reduction of sugary food and drink is beneficial for your teeth and mouth. Again, to make this conversation more tailored, we'll have the session on barriers, like what are your barriers to cut down your sugary food and drink, reduce taking your sugary food and drinks. They can say that it might be craving, so we need to give them some suggestion, some advice, like when you feel that kind of craving, you can drink water or go out for a walk to divert your attention from having that craving. Or we can then encourage them to have a healthy snacks instead of taking sugary food and drink. So this kind of, again, tailored kind of advice could be provided to the patient. And again, the last part is next steps. So if they are having that kind of sugary food and drink habit, they can set a next target that, okay, I will cut down, for example, sugar in my tea and coffee. So that could be a next step. So in the next follow-up, the mental health care professionals can revisit what they set as their target and how they are doing it, and next time if they want to set a new target to gradually cut down taking sugary food and drinks. Or it can be how, as I was giving the suggestion before, how they can minimize the harmful effect of sugary food and drink. Maybe the set target could be, after having sugary food and drink, I will clean my teeth, I will rinse my mouth. So that could be a target. Next step is to give some advice on stop tobacco, using any form of tobacco, cigarette smoking, smokeless tobacco use, or any form of tobacco habit, and sensible alcohol drinking. Again, we need to make that connection that this alcohol consumption, smoking cigarette or taking smokeless tobacco, these are harmful for your teeth and mouth, and unsensible alcohol drinking, that's also harmful for your oral health. So you should try to stop smoking or stop using any form of tobacco, and we should encourage them for sensible alcohol drinking. And in the leaflet, we will provide them the NIHR guidelines, what is considered as the sensible drinking, that recommended drinking unit. Again, we need to make this conversation more tailored. We can say that do you smoke cigarette or use any form of tobacco? If they say yes, then we can say that, do you need support for quitting tobacco? They may be already getting some support from the quitting services. That's fine. We just need to make the link, and if someone wants to get the further support, they will be referred to the further getting support on the quitting tobacco services. The next part is about the help visiting a dentist for routine dental checkup or any treatment if needed. At this stage, we should emphasize that the routine dental checkup and early treatment can help your teeth to progress further, which can cause the serious consequences of those tooth decay or other condition if they remain untreated. So the mental health care professionals, they should encourage them to routinely visit dentists for routine dental checkup and do the dental treatment as early as possible. However, due to the long waiting list, we should be practical in terms of setting the expectation that due to long waiting list, it might need some time, but at least you should try to book a dentist for routine dental checkup. And for the common barrier, we can have a discussion like that: afraid of visiting a dentist, can't find a dentist, can't get appointment, can't afford for the charges, feeling too unwell to attend a dentist, or any other problem, their personal problem. They can note it down in the leaflet. And in my next step, as a mental health care professionals, we can say that when you will be allocate with a care coordinator, they will help you to find a dentist and help you visit a dentist. For those patients who already have a dentist, the further advice will be just to continue with that dentist and continue with the routine dental checkup and treatment if needed. But for someone who didn't visited a dentist, who don't have a dentist, then further support will try to be made through their care coordinator. So that's in a nutshell the routine kind of smile intervention that will be provided. However, in case some patient, if they have any urgent dental need, that should be picked up in the first part of the conversation when they will be asked about your teeth and mouth. If they say that they have severe dental pain or urgent treatment need, at that phase the mental health care professionals, they should try to help them to find some urgent dental care, and it could be calling through 111 or any other potential pathway. We are trying to investigate how the mental health care professionals can help their patient who need urgent dental support. So that's in a nutshell what the smile intervention will be, and definitely in our next meetings and training sessions we will discuss further on this. Hope you find this video helpful. Thank you.